The stay-home order, will it stay or will it go? I'm Adrienne Pedersen, today on Up Front.
The Wisconsin Supreme Court heard an important case on the future of the order. Next, what could a reopening look like? Tim Sheehy of the Metropolitan Milwaukee Association of Commerce on how they say Wisconsin can restart smart.
Plus, the pandemic may force cuts and consolidations on UW campuses. President Ray Cross on the survival of the UW system.
Taking on the issues important to Wisconsin. This is Up Front with your host, Adrienne Pedersen.
Thank you for joining us. The Wisconsin Supreme Court is deliberating a case that could change the governor's stay-home order and force the Evers administration to negotiate with Republican lawmakers over what to do next. So to recap, top Republicans sued the Evers administration over the pandemic-related order, which is now in place until May 26th. The Supreme Court heard the case on Tuesday. It included this warning from an assistant attorney general representing the administration.
That if Safer at Home is enjoined with nothing to replace it, and people pour out into the streets, that the disease will spread like wildfire.
But it was clear from the questioning that the court's conservative majority has issues with the powers of the Department of Health Services secretary.
The people never consented to a single individual having that kind of power.
Democrats are backing the governor's extended order, but Republicans are trying to get the economy moving again sooner. So today on Up Front, what could a reopening plan look like? The Metropolitan Milwaukee Chamber of Commerce has one, and we're talking about it now with MMAC President Tim Sheehy. So Tim, we appreciate your time here. You think we're ready to start opening some more businesses starting this week. What specifically do you want to see happen that we're not already doing in Wisconsin?
Well, what we'd like to see and what we proposed is a smart restart, that we believe that from the input from our healthcare leaders, we have flattened the curve, that there is no longer a threat to the capacity in our healthcare systems. And so we believe that we should advance the governor's Badger Bounce Back plan to May 11th and begin a smart restart by opening companies and moving forward on that basis.
What types of companies do you want to see open?
Well, by the nature of Safer at Home, it's a very blunt instrument. So it closed a lot of businesses that can be open and operate safely, both in terms of their employees and their customers. Example I would use is a small retailer in Greenfield, Built Right Furniture. They sell furniture. They can open safely, protect their employees, engage their customers, and that same product is being sold at a Walmart or a Costco. And so that's what I mean about a blunt instrument. It is closing some businesses that could be open today.
So does your plan work on a case-by-case basis?
No, I think what it says is that the gating criteria tells us that we have, again, flattened the curve. The healthcare institutions are in a good place. We're seeing a declining number of hospitalizations, a declining number of deaths, and that we can start to reopen an economy that is going to have to operate for some period of time now until there's a vaccine. And again, what's going to moderate the opening of the businesses is the confidence of the customer and the ability for the employee to come safely to work.
Do you think the customer will be confident to start going out in public and going into some businesses as early as this week?
Well, some will and some won't. And that's the kind of whole concept here of, as we start to open the economy, it's really going to be the consumer and the employee. I know, for example, if businesses opened this week on May 11th, there will be plenty of employers who will have their employees that can continue to work remotely because they haven't set up a process for that to bring them back, and they don't view it safe to do that. Others will. And I think, again, we're going to have to continue to move through this process in an iterative fashion, governed by, again, employee confidence and consumer confidence.
What about something like restaurants? What would the plan for that be?
Well, again, I think restaurants, some are going to be able to configure themselves to open safely. And if they do so, they're still going to have to attract customers to come into those locations. Others aren't going to be able to do that, and they're going to have to find out a different way of opening or a slower way of opening.
Milwaukee County is the county with the most coronavirus cases in the entire state. How do you make sure that employers would be keeping people safe?
Well, I think what we look at again is this first criteria before we start to reopen is, do we have the capacity in our healthcare systems to serve people? And we do, and the hospitals have demonstrated that. The next step here again is to start to open in a way that allows people to come into those businesses, to engage in their workplace in a safe fashion. And that's going to mean protective covering. That's going to mean social distancing. Just because Safer at Home comes off doesn't mean that the gate's going to swing wide open. But we need to begin to balance the safety concerns with the health concerns, with the community concerns, and with the economy concerns. And when we see 500,000 people file for unemployment over the last month or so, that's 15 times higher than last year.
And there are 4 healthcare CEOs on the board there at MMAC. What have they said in terms of this plan, in terms of starting to reopen more businesses this week?
So the 4 healthcare leaders, along with a 5th, the medical college, were all part of a unanimous vote by our board to take this next step. And what the healthcare leaders are telling us is that they're beginning to bring back patients for surgeries and procedures in their own institutions, and that they believe they can safely handle where we are in this current COVID crisis, and they don't want to be viewed as a barrier to reopening the economy.
And we haven't reached some of those benchmarks that the governor wants to see, like the 14-day downward trend in cases and then the 14-day downward trajectory in the percentage, because of course we know there's more testing now. When was the last time you spoke with the governor, and what was that conversation like?
Sure. I spoke with the governor as recently as Monday, and we talked about that criteria and those conversations. And again, we're seeing a trend line when you plot all the dots on the map, the data points. We're seeing a declining trend line in the percentage of new cases. But most importantly, we're seeing a decline in the number of hospitalizations and a decline in the number of deaths. So we believe more of those metrics are turning green than are red. And I believe by the time this program airs that we'll see about 4 of the 6 metrics that the state has turn green.
And I was reading that you said you had some reason to believe that the governor might reopen the state even before May 26th. Why did you say that? Why were you thinking that?
Well, again, based on the metrics and the trends, and what we said to the governor was we would like to see the state open before May 26th, as soon as the week of the May 11th, and move to the first stage that he's identified of the Badger Bounce Back program, which would allow basically all businesses to open, again, with those safety criteria in place, except for bars and except for gatherings of more than 10 people. So again, this is as much about moving the state smartly to reopen as it is keeping us buttoned down. And I do want to make this point in all fairness to the governor. Of the 30% decline in the state's GDP, only about 5% is due to businesses that are closed under Safer at Home.
MMAC President Tim Sheehy, thank you.
Thank you for the opportunity.
Coming up, cuts and consolidations, the future of the UW system. I'll ask System President Ray Cross if the system's very survival is at stake. That's next on Upfront.